Welcome to Dentistry Explorer. Today we'll be talking regarding the dental treatment during the COVID-19 pandemic, how suspected cases of the COVID-19 are treated in dental clinic, and what are the guidelines by CDC and ADA. World is in a crisis since 2-3 months. Novel coronavirus is causing very difficult situation to the daily life as far as the other business and all. Dentistry is also affected by this novel coronavirus. Today we are discussing about some of the critical aspects that the dentistry is facing in this pandemic. Many health organizations such as World Health Organization, CDC, American Dental Association, along with various agencies, are working how to reduce the total exposure of the COVID-19. In the screen, there is total number of confirmed cases, total death, and total active cases till now. Coronavirus is very dangerous because this virus have been shown to survival in aerosol for an hour on some surface. It survived for days. This property of the virus threatens us to stop our daily activities. Death rate of the COVID-19 is varying in a different country, and there is still possibility of the second wave as well. Are dental clinic still running? The practice of the dentistry involves the use of rotary dental and surgical instruments such as handpieces and ultrasonic scaler and the ear syringe. These instruments create a visible spray that contains large particle droplets of the water, saliva, blood, microorganisms, and other debris. Surgical masks protect the mucous membrane of the mouth and the nose from droplet splatter, but they do not provide the complete protection against the inhalation of the airborne infectious agent. So, dental clinics are partially open in this pandemic. We must be conscious that the patient with the emergency must be treated, but with the proper safety of the dentist as well as other healthcare professionals. Why dental hospital and the clinic are closed? Most of the dental procedure require aerosol generating equipment. In our current setup, in most of the dental clinic, airborne precaution is not possible as they are not designed or equipped to provide this standard of the care with safety from risk of transmission. Most of the dental clinic and the hospital do not have airborne infection isolation room. They do not routinely stock N95 respirator as whole world is under shortage of personal protective equipment. Even in a normal condition, dentists are at more risk of infection transfer during the treatment. COVID-19 is more dangerous because of its high transmission rate. At every time, above all the medical profession, dentistry is always in a leading position regarding the infection control as they are usually at more risk due to the instrumentation type. In order to protect staff and preserve PPE, CDC recommends the dental facilities postpone elective procedures, surgeries, and non-urgent dental visits, and prioritize urgent and emergency visits and procedures. Service should be limited only up to emergency visit during this period of pandemic. This action helps staff and patients stay safe, preserve PPE, and expand available health system capacity. Ask staff to stay home if they are sick or they develop symptoms related to COVID-19. How to perform emergency dental care during this pandemic. First, to telephone trials for all the patients who need emergency dental care. Use tele-dentistry rather than office dental care if possible. If dental treatment can be delayed, provide patient with some home care instruction and any appropriate pharmaceuticals. How to treat suspected case of COVID-19 in dental hospital. Only emergency care for such suspected case should be performed. Airborne precaution and isolation room with a negative pressure related to surrounding area and use of N95 filtering disposable respirator for a person entering the room should be followed. All the dental healthcare providers should demonstrate and must understand these points beforehand to treat the suspected case. When and how to use a PPE, what PPE is necessary for the which condition, how to properly use and doff PPE in a manner to prevent self-contamination, how to properly dispose of or disinfect and maintain the PPE, limitation of PPE during this pandemic, emergency care to the patient without COVID-19 in dental clinic during this pandemic. Patients should be asked for respiratory and other related symptoms as well as travel history or contact with a probable suspected case of COVID-19. If all those history is negative, patient can be treated in emergency. Dental care may be provided by using appropriate engineering control and strict infection control. Patient without COVID-19 in a dental clinic during this pandemic. Avoid aerosol generating procedure whenever it is possible. Try to complete procedure automatic and minimally invasive, so use hand instrument if possible. If aerosol generating procedure are necessary for emergency care, use four-handed dentistry and high evacuation suction and dental dam to minimize the droplet and splatter and aerosol. Visitors should not be allowed to a procedural room. Cloth face masks are not preferred over the N95 and the surgical mask. Limit the use of PPE, as whose job do not require PPE should continue to wear the cloth face mask. All the dental care providers should be trained to use PPE and infection control protocol during this pandemic. Are dental clinics totally closed? For a few weeks of pandemic, most of dental clinics are closed, but after CDC and ADA guideline come, they are now providing emergency dental care. But regarding routine dental OPD, they are still closed. What should we do at home to maintain good oral health in this pandemic? Brush and floss regularly, eat a healthy and low sugar diet, avoid cleansing or grinding of the tooth, call for a local dental clinic with any questions or concerns. What to do if toothache during this pandemic? You can contact to your nearby dental clinic. Thank you for watching this. Don't forget to subscribe our channel and please mention the topic that you need to know in the comments.